for you today. Let me bring into the studio Chris Labreque from Paytient. Hey, Chris, how you doing?
I'm doing well, Lou. Thanks for having me.
I have deja vu. It's just bizarre.
Yeah.
So,
Understandable.
well, full transparency, Chris and I taped this last week, but I had a glitch here on StreamYard. So great to talk to you again.
Yeah. Evidently the 7:00 show is different than the 9:00 show, right?
Exactly. Exactly. So Chris is the Chief Customer Officer at a company called Paytient. That's with a Y, so it's Paytient, which I love, and I can't wait to introduce what Chris does, what the company does, and how it really addresses this huge problem we have in the U.S. of medical debt, and kind of uninformed consumers, surprise medical bills, all of that sort of stuff. So Chris, I don't know if you want to give a little bit more of your background, the company's background, before we get started.
Sure, that'd be great. So I kind of cut my teeth as a broker consultant for 31 years, starting in New Jersey, then moving to Florida, and ending that part of my professional life with Insurance Office of America, running their benefits division out of Orlando. Totally understand the broker environment and lived it long enough to understand that real well. Resigned in December of last year and came on board here at Paytient in February. I think it's like 222 days, but who's counting? Really loving it. Great company with a high intellect packed into this group. Really smart folks. But what we're doing now is really a difference maker. I heard a broker say to me this week that we're measured by our differences, not our similarities, broker to broker.
Yeah.
So I believe this is a difference maker. So what Paytient does is we provide employees of sponsoring employers with a interest-free, no-fee credit card to help offset expenses that they have across their benefits platform, medical, dental, RX, mental health, including veterinary medicine as well, or veterinary costs. We have 800,000 members across our platform and over 1,400 employers. And it's a simple little thing that, it has shown to have elegance in its simplicity, but effectiveness in its reach. It touches so many things. I like to call it a force multiplier, or a veneer, a performance veneer across a benefits platform. And I know the broker community pretty well. I know how hard they work to architect something that's relevant, personal for that employer and their end users, their employees, as well as effective. The question comes down to, are we recognizing emotionally and intellectually and professionally the struggle that the average person has to come up with the money to pay for a medical event or just a healthcare event in and of itself? And we can talk, more in depth about what our data is reflecting around that and how painful it truly is based on the utilization that we see. But the company's doing some extraordinary things, getting some very exciting conversations. We've just landed a couple of very large employers. We range anywhere, let's say 50 lives all the way up to 1 million, kicking the tires now with some Fortune 10 companies. It's just become very clear that people want to use this as a differentiator. They want to use it as something to stand out in the benefits community, but they're also recognizing that it's a delightful thing at the end user level, and it's having an extraordinary impact day one and throughout the benefits continuum, which I think we'll probably get into during this conversation as well, Lou.
Yeah, no, absolutely. And we were in the industry. I'm still, we're still both in the benefits industry. I'm still on the dark side, I guess, trying to shine a light on the health insurance and healthcare costs. And having gone through this whole spectrum of managed care from the early 90s up till today, and how the out-of-pocket costs have just evolved from $2 to $5 copays in the early days, zero cost prescriptions, zero cost ER inpatient hospitals, all the way up to these very high deductible health plans. That process is something that, you could argue now, because of the transparency laws, it probably was avoidable. These two very large ecosystems of healthcare and health insurance really haven't served their members and patients as well as they should have, and they've taken advantage of employer groups, plan sponsors. So, we have to look inward to see how we can address the type of plans that are being offered today, but you're not going to avoid out-of-pocket costs completely overnight. Although there are some plans that we can create, and I know a lot of advisors, especially in the Health Rosetta community, that are building plans with zero copay generic, zero copay primary care. We really want to get back to the basics of healthcare, but you can't avoid the fact that the economy being what it is, the average person having, I think, less than $1,000 in the bank, and still, even with all the legislation, being steered through a healthcare system that can lead to very high out-of-pocket costs, and unfortunately, too many people find out after they've had the test or avoid tests because they've had this issue in the past. And that's the beautiful thing I think about. And it is so simple. What you guys are doing is just essentially it's a rolling line of credit for employees.
That's
right.
correct.
That an employer sponsors, interest fee for the employees, which is unbelievable. So explain the mechanism or the mechanics of how it works. Like you get 100-person group. How do they do this?
What does that look like? I just want to scroll back to something you said, if you don't mind.
Sure.
Throughout my career, the pendulum has certainly swung.
First
there you go, your health food, right? It's swung so far. I can recall when I was a broker in New Jersey, the New Jersey State Health Benefits Program had a $1 RX copay that you could actually submit your copay to your major medical. And if you had met your deductible, you could get 80 cents back on the 80-20 split on every dollar.
Wow.
Now the out-of-pocket expense is extraordinarily higher, and makes it, so that pendulum has swung very far. How does it work? So an employer decides they want to integrate this into their benefits platform. They go through open enrollment. We provide all of the, the talking points and materials. The employee has, as of the day that they go live, they can download the app onto their phone. They go through a process to sign up, and they go through what's called an ATR process. It's important to note that it's called ability to repay. So we're going to ask the member what their monthly income is and what their monthly debt is. And as a result of that, we're going to either issue or not issue the credit that the employer has set, the credit limit that the employer has set.
Okay.
98% of the people that go through that ATR process get approved. And that tells us that we are reaching the vulnerable who we want to reach. We see our highest utilizers being, those in economically challenged zip codes. That's our highest utilizer. That's exactly what we want. We want to reach the vulnerable. That creates a health equity situation. So, and we can talk at length about that as well. But the member downloads the app. Once they download the app and go through the ATR process, they have a virtual card on their phone instantaneously. And I just went through this about 6 weeks ago. My wife was taking the dog fixed, and it was about a $500 expense. We knew that in advance, and we decided to use the card. I used it again this week when my wife filled a prescription for a pair of glasses. The process for me to download and go through the ATR took less than 3 minutes. So had I been sitting in the waiting room at the vet's office, I could have just downloaded and had it. Swipe the card, either physical or virtual. Swipe it at the provider's office, as long as they accept Visa, because we run on the rails of Visa. Then the card can be used. Instantly, your app pings you and says, "Hey, great, got this expense. Pick your repayment term." Walks you through the repayment terms for my wife's glasses. I think I spread it over the next 4 pay periods, and just hit set it and forget it. And I got an email, because I picked email to be how they communicate with me. Within 15 minutes, I got an email that said, it basically explained everything that I had done and showed me my account balance, because that was the second charge that I had. The member experience, I will tell you, our front end and back end engineers are incredible. The feedback we get from our members, and we have an open Slack channel through Trustpilot. We get we have a 90+ net promoter score, which in my 31 years as a broker, I saw very few vendor partners that could boast that. And that's over 5 years running. They've created a delightful experience. We hear about the value of the card and the value of affordability and access from our members, but we also hear about the delight of the ease of use. And ultimately, that can make a huge difference.
Oh, absolutely.
If you were to call any of the big insurance companies as a member to get guidance on just about anything, it's not a frictionless process. We feel that our card is a frictionless process. It's very easy to use, and that's the feedback we get from our members. So that's how the program works. At that point, and that can happen anytime during the year, right? So it's off open enrollment that these things occur. You download the app during open enrollment, so you're ready when you go live at 12:01 a.m. on January 1st, assuming that's your date. But your medical event's going to happen when it happens. Your
Right.
son twists his ankle sliding into home plate, and you're on your way to the emergency room 10 minutes later on April 13th at 3 o'clock in the afternoon. Well, you swipe that card and the next payroll is going to reflect your repayment terms. So we are in constant cadence with HR and the payroll teams to provide them with the information so that payrolls adjust. It's very, very light lift for HR or anyone who's responsible for that. So the administrative delight is equal to the end user delight. But the feedback we get from HR, we have a very, very large hotel chain that went live with us on September 1st. And on the 26th, their senior HR folks were presenting back to executive leadership the success of the launch of the program. What they said to us was, this is the best launch of any benefit that we have ever launched at this hotel chain. Now, I'm refraining from using their name because I don't have their approval just yet. I don't think they'd have a problem with it because they're so delighted by it.
Yeah.
And the activation, the utilization is well in line, actually north of what they expected, but below the benchmark that we want to see for them. So we're extraordinarily excited about getting them to that benchmark. So clearly, the administrative ease of use is there. It's a light lift. For the cost compared to the impact, it has one of the bigger deltas that you're going to find in an employee benefit. So think of it again as a force multiplier across all those different lines that it can cover. Employers can choose to say, okay, I don't really want to use this for dental. I really need this for medical and RX. Or, I don't want to include veterinary because we have a pet program, the pet insurance that we want to focus on. They can choose those things. They also choose the credit limit as well, which is generally set. But the repayment terms are chosen by the individual user, so they can help fit their own budget. So I got that question from a PEO this morning via email. I was like, what are the repayment terms? My response was, that's chosen by the end user. It runs anywhere from 12 months to 36 months, believe it or not. The average repayment term that we see across the 800,000 members that we have is just under 6 months. It's 5 months, 5 3/4 of a month. The payment terms run through. And this is really important to stress here, Lou. The average swipe amount, so what people are financing as of the end of July this year, is $118.
Wow.
That is extraordinary. Now, honestly, I was very fortunate in my career to be a broker for a very long period of time. And I can say that, the last 10 years were, I did pretty well for myself. So financially, I think intellectually, I understood the financial difficulty to pay a $500 deductible, $1,000, a $3,000 deductible. But emotionally, I didn't experience that.
Right.
And so I don't know that I recognized that as much as I could have as a broker consultant when I was looking at these plan designs. And if I were a broker today, I would be layering this across the top to assure that the vulnerable population that also happen to often, and this is statistically speaking, be in a single disease state or a multi, comorbidity state.
Yeah.
And those are the ones we want to reach, those are the ones we need to get to. I want to make sure that they are accessing their healthcare benefits in a responsible way. So what we saw in 2020, a precipitous drop in care, right? And now we see inflation. So there's a lot of pent up demand that is sitting on the sidelines right now. And as a consultant over the last few years, I was very concerned about that. I had concerns. I was hearing from stop loss underwriters. I was hearing from carrier underwriters. I was hearing from anyone who really understood that this is coming. It's going to continue to come. And the financial pressure that people have is causing them not to re-engage in their healthcare journey.
Right.
Across our 800,000 member platform, we're seeing people come back into their health systems, come back into their own journey in a deliberate and a responsible way that provides them with the ability to pay and the dignity to pay that goes with that. Right? Financial challenges at the individual level become mental health challenges, which become overall physical health challenges. And to the degree that you can help people in this regard, just smooth out those payments over time, it allows them to do so with a sense of confidence. Because you said it, right? It's a rolling line of credit. Think of it like a healthcare wallet. The employer is basically saying to the employee, we're going to provide you with a $3,000 healthcare wallet to use as you need to. And I liken it back to when my son was 11 years old. He's 20 now, so he's a man. But at 11 years old, he said to me, Dad, buy me that. And I said, well, you have $100 in your savings account. Why don't you buy it? And he looked at me, he goes, maybe I don't need it. So the point is the care seeking patterns change when people have the ability to pay. And they're typically more, in a healthy way, discriminating about how they're going to access care, how they're going to use it. But I'm incredibly encouraged by what we're seeing from a utilization pattern standpoint. It's people going back to their specialist, repeating, the ability to afford the prescriptions that they're on to hold their disease management state in the right way. They're going back to visit with their OBGYN. They're going back to visit with their cardiologist because they can afford to. And, the inflationary pressures right now that are out there, and, the cost of milk, the cost of eggs, the cost of gas, there's lots of pressure out there. And hopefully we'll see an abatement in that. But in the meantime, we at Paytient want to make sure that people are accessing the care in a responsible way so they don't become a stop loss hit, a high cost claimant later on down the road. So when I think about controlling cost of healthcare, I think of three horizons. The immediate horizon, what is the employer paying today for all the services that they're getting, right? And then there's the midterm horizon. What are the care seeking patterns? Are people going in the hospital for an MRI? Or are they going to the standalone facility? Are they going to a center of excellence that has typically lowest per unit cost, best outcome? And then there's the third horizon, which is what disease states do we have that we need to manage? Do we have diabetics? Do we have cancer patients or pre-cancer patients? Do we have heart situations and cholesterol issues? And as a broker consultant, you got to keep your eyes on all three of those horizons, because if you leave one unchecked, it can cause problems for the other two and the overall system. So we feel that we're checking all three boxes. The first box in immediate cost is we see a much higher plan migration to the high deductible programs with our product on the front end of it. And so we're seeing more people. So ultimately what happens is if the open enrollment messaging is done the way it should be, the patient program is going to pay for itself, because the employer's contribution and the employee's contribution are both being relieved by the migration to the high deductible plan. The worry is when you do that without a patient card, is basically you're baiting that employee out there with a low premium that they bite on, not realizing the implications of what a high deductible plan can mean. I think the broker community does a great job in communicating that during open enrollment, but do people hear it? Do they digest it? Do they truly understand it? The answer is no. And so they learn that later on when they actually have a claim. So we check that box because plan migration helps it pay for itself and brings relief to a 30% renewal for a 75 life group in that market where it's really challenging. And there's not a lot of things that the employer can do to save money other than take even greater risk. So it's usually contribution or plan design. But it comes with an issue later on down the road, because when people do use the system, they're typically, in a much worse disease state because they didn't use the system in the meantime. But then there's the population health management aspect, which is if you're getting people back into their healthcare journey, you're avoiding them from becoming stop loss hits and just degrading health over time. And we have the ability also to influence care seeking patterns. When you attach the product to certain things. it can influence behavior from a buyer standpoint.
Yeah, it's important for like the plan sponsors, you know, to understand that if you're large enough to be experience rated, if you're self-insured, your overall cost to insure the healthcare risk of your employees is contingent upon the claim spend, right? The expected claim spend, then the corridor, right? That the carriers will attach 20-25% on top of that. And if you can, for me, what I love about this is that it's another tool for an advisor who's really looking to change the conversation and the mindset away from the insurance and onto the cost and the quality of healthcare. You're putting a tool in that patient's hands, that member's hands, that they're going to use as they enter the healthcare system. So it allows us to, while we're having this conversation about how great this is, you know, this benefit their employers are extending to them. Now, how do you use that? How do you take it a step further and teach them how to become a true consumer of healthcare? Because you know, when they know this is their money. Let's just say I apply for a $2,000 line of credit. I can have that conversation as an advisor now and say, did you know that the spectrum of the cost for an MRI within 10 miles of where your office is or where you reside could be in the low hundreds? It could be a $300, $400, $500, $600 MRI. The very same MRI could be $5,000.
Yeah.
Right? That's your money now. It always was, depending on the type of tool that you have, you know, at your disposal and plan design. You can get that person more and more often to say, well, I don't want a line of credit. Why should I blow through my whole line of credit for an MRI? I'm going to do some research. I'm going to other tools potentially that employer is deploying, whether it be just the carrier site where, you know, they have to offer these things now. But it just, for me, it seems like, why wouldn't an employer do this? The goodwill to put that in your benefit portfolio when you have your open enrollment and set here. And by the way, and then I would imagine, you know, 800,000 is a lot of members, but that means there's a lot of people that haven't even seen or heard of anything like this. And they could say, wow, my employer really cares about me. They've taken it a step further, and this is it's not a 5% interest. It's not a 6, you know, which would be competitive in today's, you know, economy. 0% interest, rolling line of credit is just amazing. I don't know if you touched on this. This is a post-tax deduction out of payroll, right?
That is correct. It's post-tax, so it lays alongside of HSAs and FSAs very effectively.
That's what I was getting at.
It doesn't disrupt
your ability to offer those type of financial, mechanisms as well.
That's correct. They're not mutually exclusive. They actually complement each other extremely well. Also of note is if an employee fulfills their full amount on day one, $3,000, and quits on day two, the employer is not responsible for that balance. That falls on our credit facility, our responsibility to collect from that employee. And of note, we have an ethos in this company of do no harm. We never report anyone to a credit bureau or a credit facility under any circumstances, nor do we sell our debt to a credit facility for collection. We handle it all in-house here. We have a default rate that we think is very manageable. As it turns out, very encouraging. People actually do want to pay their bills. If you work with them and spread it out over time, they're respectful in that process as we're respectful with them. If they can't pay it back, we're going to write it off. But the employer is not responsible for this, unlike what you see in FSA.
Right.
Use it or lose it on both ends of the spectrum there between the employer and the employee, and an HSA where it's 100% vested right out of the gate. We've seen brokers use this, in conjunction with the HSA, where the employer doesn't have to now put as much into the HSA because they can offset it with this. With an average rate anywhere between, a PEPM between $2 and $4, depending on the credit limits, turnover, and some of the other risk factors. It's an inexpensive way to amplify some of the things that the employer is trying to accomplish and the broker's trying to accomplish for sure. Right. And you talk about spend versus price, right? I mean, that's a conversation I used to have with my P&C partners,
Yeah.
who all look at price. Right? What does the market say the price is? We were always focused on spend. What are the underlying drivers? And how can we bring that down? Is it the facilities people are using? Is it the health of the population? Is it the education and the understanding of how to use these things? And that's one of the things I can't touch on enough. Most people understand how to use a Visa card.
Yeah.
And given the time and inclination, they become pretty clever about how and when they use it. So you just need to put it in their hands and allow them to figure that out. The feedback we get is, it's very simple. It's easy to use and easy to understand. And that actually amplifies how people feel about the entire benefits platform, not just patient alone. So we've heard, and we do business on the ACA platform with a number of the large insurance companies as well. And we were told by one of them that they recognized a 70% increase, 70 increase in their net promoter scores when they embedded our product in their product. Wow. Now that's the exchange. So that comes with what it comes with, right? Price, benefits. Sure. It's, might not be the richest of plan designs and cost that you would see in the market, but clearly a 70% lift, those are their words, not ours, is substantial and speaks to that. So again, as a consultant, you always take risk in putting a solution out there for an HR person or CFO, whoever you're talking to in the employer, and then they're further taking risk by installing the product. Right. The feedback we get is the delta from the cost to the impact and the feedback is substantially greater than they see with other benefits that they put in place. And the fact that this touches all the other benefits in the right way, based on what our data is telling us, is extraordinary.
Well, and I'm assuming the answer to this is anytime, but it can be implemented at any point during the year. You don't have to do this necessarily at open enrollment, I would imagine, where maybe that would intimidate an HR, leader or team because they have so much going on at that time of the year. There's no renewal date. There's no open enrollment. Everybody who's meets a certain criteria. Let's just say full-time employees working 30 or more hours per week. If that's something that the employer determines, that's it. They're all technically eligible for the program.
That's correct. The employer determines the eligibility, they determine the limit, and they determine when they want to roll it out. So we had a Fortune 500 company, one of our longer term clients who loves this program, roll it out for their HSA population. And very shortly thereafter said, I got to get this to everyone else because the HSA population is telling everyone else how great it is. And so it worked really well for them. We had another employer who said, we just went through open enrollment and then did an employee survey. And the feedback we got was not great, not glowing. So we decided to launch, 3 months after open enrollment, this product, and that turned around the sentiment of their employees, 180 degrees. So yeah, doing it off, we love off open enrollment because we don't get caught in the vortex of noise that all of the other messaging has. We know we're going to get individual attention spans, and we're going to create the necessary awareness for people to know this is here, when to use it, and how to use it. But we also recognize that we are seen as an employee benefit per se, and so we know what the rhythms and sales cycles look like. And we follow that as well. But, recommending off renewal is a strong move. And it's not a big budgetary item. So it's fairly easy to do. The lift of implementation is extraordinarily easy compared to anything else. I mean, a PBM carve out would be a tough one. Reference-based pricing would be extremely difficult. Network changes can be disruptive even today to some degree, because it's always the CFO's wife's OBGYN who's not in the new network. Just the way it is. You have 99% overlap, and there's the 1% is the CEO's wife. You don't really have a lot of those issues here. And we implemented a 20,000 life group on September 1st, and we did it inside 30 days, and it was flawless. That's the hotel chain that loved us. So I had heartburn when I thought that we only had 30 days to make it happen, but pulled it off and did it in fine fashion. So
That's,
off renewal. I'm
yeah.
sorry for the long diatribe there, but off
No, that's
renewal
okay.
is definitely something we emphasize.
And then, so it can dependents, whoever's, again, the employer maybe can set the dependent eligibility, but does it typically follow the benefit, medical eligibility? And
as determined by the employer, yeah,
okay,
absolutely. One broker used this to incentivize spousal carve out. So they attach the card to if you're going through the spousal carve out, we'll help you with this. Some employers use it as a quote unquote mini med plan. It's not a mini med plan, so I don't want
right,
to I don't want to conflate the conversation, but they're using it for part-timers to increase retention, because we've seen across our 800,000, actually across 11,000 lives, and I think 67 employers, we saw about a 10% delta in turnover for those who actually downloaded and used the card versus those who did not. I don't think Brian Worley, my founder and CEO, envisioned that impact when he started the company 5 years ago.
yeah,
But I'll take it, and I'll brag about it as much as I possibly can, especially in this tight labor market, that this can be a difference maker.
Sure.
Works really well for the gig economy. There's a lot of clever applications, some of which we're not even coming up with. Our clients and brokers and others are coming up with. We're very flexible at this point in our lifespan of product, so we're willing to entertain some unique ways to use the product itself.
And if someone pays, I'm thinking of like an HSA plan or a high deductible health plan. I usually recommend not for the patient not to pay at the point of sale, because they don't know yet what the allowable amount might be if they're using a network, right? So you have a $2,000 bill. I just went through this with my wife with our FSA. My daughter had her teeth extracted. It was an in-network dentist, but the dentist made a cost estimate and said it's going to be $931 out of pocket. She used her FSA to pay for it. And I said, you shouldn't have done that, but whatever. Because after all was said and done and the claim was adjudicated, our out of pocket was only $725. So I actually had to refund. I had to write a check, refund the HSA. They wouldn't just offset the difference. I had to refund the amount because it was technically an ineligible charge from my bank account, and then resubmit a paper claim to get a check back, which I got a check. I don't know if I got the check back, a refund check back from our FSA company. So, that's
not exactly a frictionless experience.
Yeah. So I guess my question is, you can wait. It doesn't have to be a point of sale. Now you get an explanation of benefits. You get an invoice from a provider. Usually you get a slip. It says, use this Visa information. You could fill that out, use your Visa information, send it in, and it would be a manual transaction against the card.
That's correct. Yeah, I mean it's easy. That's the point of it all, right? So and we have situations where an employee will use our card first, even though it's eligible for HSA or FSA, and then they'll repay our card or change. I think it's 95% of the employer space clients that we have run their repayment terms through payroll. But because we're regulated by the banking industry, we can't just force people to do that. They can attach it to a savings account, checking account, investment account,
they can.
HSA, FSA. Yes, absolutely. It can go. They can go off payroll. We give them the right to do that. Most take payroll anyway, so they'll use our card first and then repay that through HSA if it's eligible.
Okay.
Once
So
they get a chance to sit down. Look again. Healthcare events are not like vacations. I'm planning to go to Bermuda next year. I'm planning this. Healthcare events occur. We get thrown into them. So you're not always thinking as clearly as you need to in the moment. It's nice to have something just to level set, take care of it. Now I can come back and figure out how I want to handle that in my budget and my terms. And of note too, if you have an event, you swipe the card and you don't choose repayment terms, within 24 hours, it's going to default to whatever you set up when you did the app. 4 payments, 5 payments, 6 payments, it'll just default to that. And you can make changes. We have people who have had In the first month of use, they had $1,000 expense, and the following month, unfortunately, had a $500 expense. Well, that changed their budgetary needs. So they wanted to change the $1,000 expense repayment terms, and they can do that. Again, the ethos is do no harm, meet people where they are, and be as flexible as you possibly can to support them. And quite frankly, you'd be surprised at, what that does for them from a health standpoint, just from a mental health standpoint as well.
Yeah, well, I know, having gone through as many open enrollments as I have over the last 30 years, that, people, there's two kind of mindsets, right? One mindset is, well, what if, and they'll overinsure themselves. So they're spending more money than necessary because 1 out of every 5 or 10 years, they had an event and they remembered it and it wasn't pleasant. So they're scared and they're like, well, I'll just pay $100, out of every payroll. But now, could be $400 more a month that you're paying $5,000 for a what if, as opposed to purchasing the plan that you believe under normal circumstances would be the best fit for you, and then having this as a stopgap on the back end, that comfort zone of knowing I don't have money in my bank account. I don't want to put more money on my credit cards. I don't want to go to collection again. 20% interest rates on a lot of those cards and things these days. So it gives you a lot of peace of mind, I would imagine. So I could definitely see that migration of members into a more suitable lower option plan being pretty significant.
Yeah, that 100% correct. I think the what if crowd is the ones that actually kind of connect to the card itself and migrate to a plan design that brings them financial relief. They're paying a lot for that what if. We know this, right? The delta between a high deductible or even a higher deductible and a PPO with a lower deductible, because you want to hang on to that sleep insurance, that's pretty expensive. I mean, household healthcare is starting to eclipse mortgages and rent in the average household, and that's frightening. So creating that relief by providing them with a healthcare wallet and the confidence and ability to pay, it changes. What it does is it right sizes individual premiums as well as plan design. Yeah. The other thing it does too, Lou, is you got a group of 100 and the CEO makes $200,000 a year and the line worker makes 35, and that $3,000 deductible that everybody gets offered is looked at very differently between those two parties. Well, that card levels that out a little bit. And so think of it from a health equity standpoint, one of the social determinants of care. We're leveling that out, and our high utilizers, again, are the ones who are in those, oftentimes they're the vulnerable, they're the disenfranchised, and those are the ones that we want to reach. It's a little bit of an Icarus moment, right? The moth and the flame. We're loaning money to the ones that probably would struggle the most to repay us. What we're finding through our utilization patterns is they're pretty smart with their money. Actually, they're very smart with their money. They're judicious with their money. They just need to be able to spread it out over time, and they'll make the right decisions. It's what we've seen, which is incredibly encouraging. I think, when you look at healthcare and you look at empowerment at the individual level, particularly as we're staring down the face of transparency, becoming something that the end user can use, I think they'll find the right way to use it very, very quickly. But it changes the perspective of how everyone views that deductible across different strata of income. And it levels that out a little bit. So the line worker doesn't feel so pinned in. And honestly, our utilization patterns, speaking of income, are fairly similar over $75,000 and under $75,000 of income. So it's not like, the people, I used it the other day, and I think I make a decent living. I used my card instead of a cash check or a credit card for obvious reasons. It's time value of money. Why not? I should max out my $5,000 limit. But again, I prefer not to have medical events to use it for. So I try to maintain my own health. But therein lies some of the subtlety of how it's viewed and what it means. It's that judicious nature of how to use the card. Well, yes, I have this $5,000, like my son not wanting to pull out of his savings account, but I really don't want to use it. What else can I do to avoid the next healthcare event so I don't use it? But I have that comfort knowing that if it does happen, I have the ability to pay. So, and we're young. We're 5 years running. This past spring, 800,000 members, 1,400 employers. But to your point, we're probably the best kept secret in the benefits industry right now. I don't see that lasting very long. Just in my short tenure here,
Yeah.
I can feel the avalanche starting to occur in a good way, in a very good way. So clearly, we've scratched an itch in the marketplace. We found a very small slice of that world, but evidently it's had a much broader impact overall.
I was looking at your the brochure that you guys had shared with me a couple weeks ago, and it's just for HR leaders out there to understand that like your largest utilization is for pharmacy for your earners that are between $25,000 and $50,000, and a lot of people don't understand that these $10, $15, $25, $30, $50, $80 copays, $200 deductible on an RX plan, they prohibit a lot of people from filling all their prescriptions. And over the years, that was the one thing when I saw the prices for the first time back in 2016, and I got so upset that I really had a flashback of all of those people who had come up to me at the end of open enrollment meetings, and they were the most vulnerable. Typically, a lot of the more seasoned employees at companies that have some chronic health conditions, otherwise pretty healthy, but would literally cry.
Yeah.
And it was very upsetting that they're already taking only 5 of their 7 medications, and this $10 copay on tier 1 and $20 increase on tier 2 medications meant they were going to have to give up another prescription. And that's the last thing an employer wants to hear. But also the flip side, and we talked about it before, is this is now a ticking time bomb of someone who might not be taking their blood pressure medication or their diabetic medication and becomes a hospitalization, much more out of pocket for the member. But for an employer that's, again, in the experience rate or self-insured market, that has consequences on the entire population simply because someone couldn't afford that $20 medication. And again, plan design can address some of those things. Consumerism, like real positive, incentivized in consumerism to get people to the best doctors. But you have to meet people and companies where they are and addressing the needs of their employees, making them capable of paying their out-of-pocket costs and not avoiding care is essential.
Yeah.
It's just central
really
to this.
Yep. I mean, so evidence of that, right? Evidence of the challenge, particularly around, as you said, as I said, the vulnerables. Stop loss underwriters look at zip codes. They look at zip codes on census because they know in food deserts that rate changes because chronic disease, high cost claimants, they spike and skyrocket in those areas. So, those are the exact folks we're reaching and trying to reach, who are using the card in a very responsible way based on the data that we see. It's 100%. Your comment about at the end of open enrollment meetings, I remember a specific scenario. I used to work with a woman at Iowa. Her name was Amy Leonard, and she had told me about a story where she sat in the back of the room afterwards for about an hour and a half with this young lady who was a single mom and struggling to make just the premium payments, and she was crying. Amy spent the extra time with her. God bless her. She's such an empathetic soul, and she worked through it with her. But that was just evidence, with one person that happens in every single room you stand in during those open enrollment meetings. And oftentimes you don't know how many of those folks are suffering that.
Right.
And so, at let's say $2.70 PEPM or 8 cents a day, why not put this performance veneer over top of a benefit plan and see what it does? See and make sure you're touching and reaching in a very empathetic way those who are struggling to make $118 average swipe payment. That's not a big number. When I looked at this company I found this company in the fall of 2022, had a conversation with Brian Worley. My expectation was, this is for high deductibles. This is for emergency rooms, surprise surgeries, big ticket items. I had no idea it was being used on the front line the way it is.
Right.
And again, in a responsible way from a population health management standpoint and from an individual member use standpoint. It was very encouraging. So yeah, it's again, a simple thing, an inexpensive thing, but it has pretty strong implications inside of a benefits plan. So we just need to get the word out. So I certainly thank you for the opportunity to speak to you and your broader audience about what we do, and love to have calls, love to have conversations, love to explore different ways to use this that maybe we haven't even thought of yet, because I know your audience is made up of some of the most creative consultants in the business, and the ones who want to drive a difference, who want to make a difference. And we need more of those folks. So little commercial for Lou.
Thank you.
Doing these moments, listen to what he's saying, listen to his guests.
I appreciate it. This show is about really kind of just spreading the news of this alternative universe of solution partners that are out there, including alternative universe of healthcare, health insurance providers, stop loss companies, independent TPAs, PBMs that are really making such a dramatic difference in the lives of so many millions of members, thousands of plan sponsors, through this ecosystem. And it's so much more rewarding. It's challenging because there has been a significant amount of grooming that's happened over the last 30 years. And in a lot of ways, people have just given up and just assumed, like death and taxes, that out-of-pocket cost and insurance premium increases were just a given, but they don't have to be. And you can be an employer. You can be, compassionate. You can really not just throw things at your employees, which some do, some avoid because of the disruption. But when you have something, to me, the first time I heard about this, I was like, wow, who wouldn't want to do this? I mean, who wouldn't want to do this?
Yeah.
So I put your website up there. I think that's correct. Website.
Yep.
And yes, reach out to the team over there at Paytient. If you want to learn more, if you're a prospect or client of mine, of course, give me a call. We'd love to have a conversation about building this in to your benefit package. So there's nothing else. I think we're good. I think we covered everything we needed to. It's a busy Q4, so I know your team's busy. I see them walking around in the background. Beautiful office, by the way.
Oh, thank you very much.
Thank you. Thank you so much for coming on today, and best of luck. Hopefully next time we talk, you'll have eclipsed the 1 million members. I'm sure that's not probably too far off.
No, I think we're pretty close. Yeah, by January 1, we should be there.
That's amazing.
Hope so for sure. We're watching that pretty closely, as you mentioned. That's going to be a hell of a celebration around here. I'm glad it didn't happen while we were on this call, because
there's a bell or alarm going on somewhere.
Would have been incredibly noisy. But,
I appreciate it. Thank you.
Awesome.
We'll talk soon. Thank you.